solving. Those are fundamental skills that are presented early to give clients the tools to cope with situations that might, overwhelm them, lead them to relapse or to treatment dropouts. So what's nice about this model, and I think patients really like that, is I want to cover, after I intake, the first 6 sessions or so are going to be these foundational sessions, right? And what that means is I want to make sure that I cover what we consider to be evidence-based knowledge, evidence-based skills that will help you cope with high-risk situations. So we have those core sessions. After the core sessions, we have a menu of topics. And based on your unique presentation, we're going to select session topics together. So usually what I do is, so you have the intake session, you have those 6 sessions that are maybe a trainee, but it be different as far as the costs associated with the treatment. That could be a part of the trade-off, so to speak. But I hope that answers your question. It's a really good one. Oh, we have a tiny little box here for for questions, but I'm kind of going through that. Someone said the video isn't working. Those video boxes are a little bit tricky, so I would just go into the webcam. That shouldn't be a problem. Oh, good. I'm picking up some more questions here, so I'm really excited. I know most clients do not like the homework. I am liking the app method to engage the clients. Me too. I totally, I totally like that. Is that, of course, they're in a manual setting, they're talking to coordinators. But what that means is let's stop and rethink the treatment here. There's treatment deterioration. If there's clinical deterioration, we don't let it continue. We take a break, we reassess, and we change the treatment plan. We change the level of care. Usually we recommend more intensive levels of care. Termination can be problematic for many clients. There can be some acting out before the end of treatment. What we tend to do is constantly communicate about how long the treatment is going to go. We tend to think a lot about, again, adding those elective sessions. We talk about going through the entire protocol again with the psych assistant or with the primary therapist. So there's a constant discussion about treatment planning, okay? Or some people might engage in more urge surfing, which is just allowing the urge to come and go. Nowadays, and also with the use of apps, you might recommend an urge surfing mindfulness exercise. So that's something that, again, you can find through apps and resources that would be kind of a direct, more kind of current application of the urge surfing in a more mindfulness way. Or, there's a thought challenging. It could be even like a coping card where they remind themselves of why they are striving for abstinence, what they stand to gain by remaining abstinent, and so forth. Okay, so we got through sessions 1 and 2, so you can see how we're kind of we're using these themes, right? We're kind of